Clostridium botulism is a severe illness caused by potent toxins produced by the bacterium Clostridium botulinum. Botulism has actually been known for centuries. The recorded history of botulism began as early as Byzantine Emperor Leo VI. As the story goes, Byzantine Emperor Leo VI prohibited people from eating blood sausage, which was associated with food poisoning. It wasn't until 1793 that it was first discovered as foodborne botulism by Justinius Kerner, a German physician. He thought a toxic substance called corpse acid was the cause of sausage poisoning. Subsequently, the term botulism was introduced, deriving from the Latin word botulus for sausage. In 1895, Emil van Emmergem, professor of bacteriology from the University of Ghent in Els, Belgium, first isolated the bacterium when he extracted a portion of ham which caused botulism and correlated Clostridium botulinum to the disease. From 1949 to the 1950s, the toxin name BONTA, abbreviated for botulinum neurotoxin, was shown to block neuromuscular transmissions in the nervous system by blocking the release of acetylcholine from motor nerve endings. Because botulism toxins are said to be some of the most toxic substances in the world, it has been considered for use as a biological weapon. Nonetheless, it has also been used to treat many medical conditions. In 1980, Dr. Alan B. Scott used the toxin to treat strabismus, which is a deviation of the eye. In 1989, the FDA approved the toxin as Botox for the treatment of strabismus, blepharospasm, and hemifacial spasm in young patients. Then, in 2002, the FDA approved the use of Botox to treat wrinkles and frown lines for cosmetic improvement. Since 2002, the FDA has approved many additional uses, including underarm sweating and muscle pain disorders. So what is Clostridium botulism? Clostridium botulism is a life-threatening, paralyzing illness that affects the body's central nervous system. It is a gram-positive, rod-shaped, anaerobic, spore-forming, and motile bacterium. They exist widely in the environment, including soil, river and seawater, and usually grow and produce toxins in food prior to consumption. So how exactly does it work? The neurotoxins affect the central nervous system and can destroy, paralyze, or adversely affect nerves or nerve tissue. Even microscopic amounts of this bacterium can cause illness or even death. The symptoms are not caused by the bacterium itself, but by the toxin produced by the bacterium. Botulinum toxins block nerve functions and can lead to respiratory and muscular paralysis. Since it affects muscle control throughout your body, botulinum toxins can cause many complications. The most immediate danger is that you won't be able to breathe, which is the most common cause of death in botulism. The zoonotic potential of Clostridium botulism is actually very minimal. However, botulism caused by the type C toxin has been confirmed in several non-human primates. Animals that can be affected by the botulism toxin include cattle, sheep, horses, mink, and ferrets. Outbreaks in waterfowl such as ducks are common. Dogs and pigs rarely get botulism, and illness in cats has not been reported. Animals become infected by ingesting vegetation that is contaminated with the toxin or through direct contact with soil that contains the bacteria. Human botulism is mainly caused by 4 of the 7 recognized types of Clostridium botulinum bacteria, types A, E, rarely F, and possibly G. The 3 most common forms of human botulism are foodborne, infant, and wound botulism. Foodborne botulism is described as descending flaccid paralysis that can cause respiratory failure and occurs with the ingestion of the toxin. Clostridium botulinum spores are found on the surfaces of fruits, vegetables, and seafood. It has in the past been linked to home canned foods that have been improperly processed or canned at home, since the bacterium grows best under low oxygen conditions. This occurs because during the process, the boiling of water and food will only destroy Clostridium botulinum and other bacteria that may be present at the time. However, the spores will not be destroyed. Then, during the canning process, it will remove all the oxygen from the jars and create the low oxygen environment that is suitable to allow the spores to grow into active bacteria. As the jars are stored in room temperature, the spores can germinate and produce the toxin. It has also been linked to foods such as unrefrigerated homemade salsa, baked potatoes sealed in aluminum foil, honey, garlic, and oil, and traditionally prepared salted or fermented fish. Clostridium botulinum cannot grow below a pH of 4.6. Therefore, acidic foods such as most fruits, tomatoes, and pickles can be safely processed in a water bath canner. However, foods with a higher pH, which include most vegetables and meats, must be processed under pressure. Ideally, a pressure cooker must be used to prevent the bacterium. This is because the pressure cooker will reach a high enough temperature to destroy the Clostridium botulinum spores. Freezer temperatures also inhibit the growth of botulinum bacteria in frozen food. Low moisture also controls its growth in dried food, and high oxygen controls its growth in fresh food. Symptoms usually appear within 12 to 36 hours after eating the food containing the neurotoxin. There have also been some cases that ranged between 4 hours to 8 days depending on how much of the toxin was consumed. Some symptoms of foodborne botulism include difficulty swallowing or speaking, dry mouth, facial weakness on both sides of the face, blurred or double vision, drooping eyes, trouble breathing, nausea, vomiting and abdominal cramps, and paralysis. Infant botulism can affect infants that are under 1 year old. However, it generally affects infants that are under 2 months old. This occurs when infants eat foods such as honey that contain spores of Clostridium botulinum. This is because the bacterium can germinate, colonize, and produce neurotoxins in the infant's intestinal tract. For this reason, the FDA, CDC, and the American Academy of Pediatrics recommend that honey not be given to children under 1 year of age. Also, fruits and vegetables should be washed before being fed to infants. Symptoms for infant botulism generally begin within 18 to 36 hours after the toxin enters the infant's body. Symptoms include constipation, which is usually the first sign, floppy movements due to muscle weakness, trouble controlling the head, weak cry, irritability, drooling, drooping eyes, tiredness, difficulty sucking or feeding, and paralysis. Wound botulism happens when the bacteria gets into a cut and can cause a dangerous infection that produces the toxin. It does not penetrate intact skin, but it can be caused by an injury that may not have been noticed and can multiply to produce the toxin under the anaerobic conditions. In recent decades, it has also increased and has been associated with substance abuse. Those who inject black tar heroin can contain spores of the bacteria. Symptoms for wound botulism usually appear 10 days after the toxin has entered the body. Symptoms usually include difficulty swallowing or speaking, facial weakness on both sides of the face, blurred or double vision, drooping eyelids, trouble breathing, and paralysis. Treatment requires quick medical attention. Since the development of the antitoxin and modern medical care, people with botulism today have a much lower chance of dying than people did in the past. If a person has botulism in a wound, a doctor may need to remove the infected tissue surgically. Antibiotics are recommended for the treatment of wound botulism, but not advised for other types of botulism. This is because they are rarely effective since the illness is caused by a toxin and not the bacteria itself. Doctors also treat botulism with a drug called an antitoxin. Since the toxin attacks the body's nerves, the role of the antitoxin is to prevent it from causing any more harm. It does this by attaching itself to the toxin that's still circulating in the bloodstream and keeps it from harming the nerves. However, it does not heal the damage that the toxin has already done. A different type of antitoxin known as botulism immune globulin is used to treat infants. Because the toxin can affect the swallowing muscles, they may give the infant IV fluids or feedings through a tube to provide nourishment. Depending on how severe the symptoms are, the person may need to stay in the hospital for weeks or even months before they are well enough to go home. If the disease is severe, the person may have breathing problems and even respiratory failure if the toxin paralyzes the muscles involved in breathing. If that happens, the doctor may put the person on a breathing machine until they are able to breathe on their own, and the paralysis caused by the toxin will improve slowly. Even with the antitoxin and intensive medical and nursing care, some patients die from other infections or other problems that are caused by being paralyzed for weeks or months. Patients who survive botulism may have fatigue and shortness of breath for years afterwards and may need long-term therapy to help them recover. A vaccine against botulism also exists, but is rarely used since its effectiveness has not been fully evaluated and it has demonstrated negative side effects. The most common potential side effects of botulism antitoxin are headache, hives or welts, itching skin, nausea, rash, and/or redness of the skin. The less common potential side effects include chills, fever, and/or throat discomfort. The potential side effects listed as rare include chest pain or discomfort, cough, difficulty while breathing, fast pound or irregular heartbeat or pulse, feeling of discomfort, increased sweating, inflammation of the joints, lightheadedness, dizziness or fainting, muscle aches, no blood pressure or pulse, noisy breathing, slow or irregular heartbeat, stopping of the heart, swollen lymph glands, tightness in the chest, unconsciousness, and/or unusual tiredness. According to the World Health Organization, incidence of botulism worldwide is low, but the mortality rate is high if prompt diagnosis and appropriate immediate treatment, which includes early administration of the antitoxin and intensive respiratory care, are not given. The disease can be fatal in 5 to 10% of cases. Botulism is even said to cause fewer deaths than bee stings. Because of better food canning processes, the number of yearly cases has dropped to about 1,000 worldwide as of 2016. According to CDC, in 2016, a total of 205 confirmed botulism cases were reported in the United States. Of those, 150 were infant, 29 were foodborne, and 24 were wound. Public health interventions to decrease the incidence rate of botulism both worldwide and in the U.S. include ensuring safe practice in food preparation, especially during heating, sterilization, and hygiene. It is also very important to stress public education on how to use proper techniques when canning foods at home to ensure that all bacteria, including spores, are destroyed. 5 keys that the World Health Organization uses as basis for educational programs to train food handlers and educate the consumers are to keep clean, to separate raw and cooked food, to cook thoroughly, to keep food at safe temperatures, and to use safe water and raw materials. And lastly, to reduce the incidence rate of infant botulism, people should avoid giving honey to children under 1 year old. One recent medical research trial that involved Clostridium botulism is the evaluation of the improvement of quality of life of patients suffering from Hailey-Hailey or diarrhea disease after injections of botulism toxin into large folds. Hailey-Hailey and diarrhea disease are rare genetic dermatosis. Clinically, patients present with inflammatory lesions located in the folds. Quality of life is impaired because of pain and tendency to infections. Lesions are permanent, but acute exacerbations occur in hot seasons because of increased sweating. Because sweating is a well-established inducing or aggravating factor, botulism toxins could be an effective treatment for these diseases. Botulism toxin is already used in clinical practice and acts via a decreased sweat secretion. The aim of the project was to study the improvement of quality of life for patients suffering from Hailey-Hailey or diarrhea diseases after injections of botulism toxin in large skin folds. The principal objective was to estimate the distribution of the variation of quality of life. The study started in September 2015 and was completed in November 2017. However, results have not yet been posted. I was unable to find any government agencies or foundations that are dedicated toward the eradication of botulism or the bacterium Clostridium botulinum. This could be because of its current use for treating multiple things in the medical and cosmetics fields. However, the CDC Botulism Consultation Service, the Alaska Division of Public Health External, and the California Department of Public Health External all provide clinical consultations on treatment and prevention for suspected cases of all types of botulism except for infant botulism. The California Infant Botulism Treatment and Prevention Program External provides clinical consultations on suspected infant botulism cases. The most important topic to address for future treatment or eradication of botulism would be the successful development of a vaccine to prevent the illness. While the current vaccine has been unsuccessful, I wonder if improving the vaccine with the inclusion of similar properties to the antitoxin will help to produce neutralizing antibodies that can help bind to and clear toxins from the circulation before it can enter nerve cells and block neurotransmission.